What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted. Welcome to Accelerate My Practice. So glad you could join us here today in the AMP studio. Last week I spoke about this handoff and catching the patient off guard. One of the challenges, and I want to reiterate it because I think it's very important, one of the challenges that I find, especially in circumstances like this where it's not a set case presentation appointment, is that we're doing the hygiene appointment and then the last 10 minutes the doctor skates on in for the exam. And in some cases, maybe we haven't spoken about restorative needs in any way, shape, or form. And now all of a sudden the patient's being sprung with $1,000 or $2,000. I think that's a critical mistake. It's kind of like, just doing something. The syntax is important. It's like starting to prep a patient's tooth before you give injection, or starting the injection before you put the topical in. To me, it's that critical of a mistake. And I think it's why some people struggle to get patients to say yes. And the reason being is I'm sitting there having a good old time, I'm thinking about a vacation, I'm chatting with my hygienist who's my friend, and I'm not thinking about spending money beyond what I've already committed to for this appointment. And now all of a sudden in the last 10 minutes it's, hey Darren, you've got $2,000 worth of treatment, oh my Lord, sorry to shock this on you, and I'm shocked, I don't know what to think, and so what's my natural response? I want to think about it. I want to think about it because I didn't have time to think about it here. So I think if we instead start prepping the patient during the hygiene appointment early on, it gives the patient time to process all of this. So I think one of the things that we should absolutely do in the first 15 minutes, and anybody who's been a client of ours long has probably seen our hygiene clock grid, where it shows in the first 15 minutes we take all of our x-rays, we do all of our probing, we look for our restorative needs, and then we start having a conversation while we're cleaning. So now while we're cleaning, instead of talking about the latest Packer game and the wild upset at the end of the football year tragically, instead of talking about that, what we're going to do is we're going to talk about, hey Darren, I think when doctor comes in, he's going to tell you that you have this going on and you're going to need this fixed. And it allows the patient to have the time to process it, ask 20 million questions, and then the doctor just has to come in with the magic wand and just bless it all of a sudden and go, ta-da, and it works very, very well because the patient had time to comprehend it, think through it, start thinking about budgetary issues. It allows them to prep a lot more. So I think that's a very, very key piece to this process that it doesn't do any good to talk about the rest if we haven't solved the issue of timing.
I think it's important because number one, the sooner you bring it into the conversation, the more time you're giving your patients to talk themselves through the shock of what they're hearing. And actually, as you're talking, I'm thinking about the first time my dentist told me I had a cavity. And I'm thinking about what was going through my mind at that moment in time because I was sitting down in the hygiene chair and they were, cleaning teeth, doing the probes, everything else, looking at x-rays. And, I'm curious, and so I'm asking, what did you see in the x-rays? Is there anything going on? And she's pointing out, well, you have a cavity here, and you might have another cavity here. And I'm sitting there thinking, this is a mistake. She doesn't know what she's talking about. I need to talk to the doctor. And just know that's probably the exact same thing your patients are saying. So between hygiene, doctor, it's important to make sure that the transition of how you guys communicate that to your patients, that everybody's in sync together. I would say let's do a role play.
And you want to play the doctor, right?
No. I'll play the patient. I'll play the patient, yeah.
Perfect.
I'm a great patient.
So let's assume that it's one of these cases. It's a hygiene scenario where I walk in and the hygienist has just said, hey, Dr. Darren, I like the sound of that. Played one on TV right now. I can actually say that now. I've talked to Shar already about the need for these fillings, whatever the case might be. We'll say two crowns as an example, and then I'm coming into the conversation, and I am assuming she's not going to make this easy on me.
That's correct. Let's go.
So
let's get started.
I'm going to do the exam real quick.
Okay.
You know, Shar, as I'm looking here in your mouth, and by this point, I'm going to sit her up, right? I've already done the exam. I'm going to sit her up so we're nose to nose. I don't want to talk to her when she's face down, or, you know, on her back looking up at me, because it's just an intimidating way to talk. So sit her up face to face, roll your chair around. So Shar, you know, my hygienist is amazing. She's absolutely right. She should have gone to dental school. She's incredible. You definitely need 2 crowns on these teeth. I'm assuming, knowing her and how good she is, she's already discussed all this with you. Do you have any questions for me about this?
I guess with the crowns, I'm not quite sure what all that entails. What does that look like as far as putting on crowns?
Okay. So
why?
Do you know
crowns?
What a crown is?
No, I have no idea.
Okay. So we have a couple options. One, and the easiest option right now, I'm going to step out of role play mode, is I'm going to hit play on a Casey video and I'm going to walk out. But we'll assume for the sake of TV here, we don't have Casey. So what a crown is think of a cap, if you will, and which like even a baseball hat. So what we're going to do is we're going to remove all the unhealthy tooth, which there sadly is quite a bit in these 2 teeth. And then what we're going to do is we're going to put a beautiful tooth on there that I've made. And we'll be able to do this in 1 appointment in our office. We have that luxury of being able to do it in 1 appointment. Some don't, but in our case we do. So we'll have you back in a week or 10 days, and we'll remove the bad, and we'll put back a beautiful, awesome tooth that'll feel amazing, look amazing, and if you take good care of it, it'll last a lifetime for you.
How long is that appointment for 2 crowns?
Oh, about an hour and a half, 2 hours, so not too bad. Pretty quick.
Oh my God, I don't have time for this.
Any concluding thoughts?
Absolutely. Just remember what factors you're coming up against, right? The emotional part that you're getting into within that patient. So understand first reactions based off of my reaction, and then in the video clip we showed you, that's an emotional knee-jerk response. So instead of responding to that knee-jerk reaction, let it happen, and then just stay objective and focused on the treatment that you have to present to the patient.
Perfect. So one of the things I wanted to do was to role play a big case, and obviously we ran out of time here today, so I think what we're going to do is stay behind in the studio after this show is over and record another one for next week, which will be us literally role playing a bigger case, how to go through it, and I think the entire show, depending on time, will be us literally playing that whole scenario out from start to finish, and I hope you'll enjoy it a whole lot. I hope you enjoyed the show today. We look forward to seeing you next week, 8 a.m. on Mountain, 10 a.m. on the East Coast. Won't be live because we'll be recording it, but you'll love it nonetheless. Probably be wearing the same shirt.
Yep.
Until then, have a wonderful week. We'll see you later.
Have a good one.
What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted.